Bismillah Rahman Rahim. Assalamu alaikum. Have you ever felt like that your mind just won't stop racing? Like no matter how much you try, you can't stop worrying about things that don't even seem that serious to others. Well, today I want to talk about something millions of people deal with every day: generalized anxiety disorder, or GAD, and I will explain it through a story. Let me introduce you to Mr. Rahil, a 32 years old software engineer. On the outside, his life seems perfect. He has a stable job, a supportive wife, and no major problems. But for the past 8 months, Rahil has been struggling with something invisible. Rahil feels anxious about everything: his work, his finances, and even small things like forgetting to reply to an email or being late to a meeting. Even when things are going well, he can't shake the feeling that something bad is about to happen. He knows these thoughts are irrational, but he just can't stop them. And it's not just in his mind, his body feels it too. Rahil cannot sleep at night. He tosses and turns, replaying his worries over and over again. During the day, he feels exhausted. His muscles are tense, and he often gets headaches. All of this has started affecting his work and relationships. He finds it hard to concentrate at his job and feels irritable around his loved ones. Rahel didn't understand what was happening to him until he visited me and learned about generalized anxiety disorder. Generalized anxiety disorder is more than just worrying too much. It's a condition where your brain's alarm system gets stuck in the on position, making you feel anxious almost all the time, even when there is no real reason to be. Some people think, why can't he just calm down? But anxiety does not work that way. It's not a sign of weakness or overthinking. It's a medical condition, just like diabetes or high blood pressure. And the good news is, it is treatable. So, what helped Rahil? First, he started therapy, specifically cognitive behavioral therapy or CBT. This helped him understand his anxious thoughts and gave him tools to manage them. Second, he made small but important lifestyle changes, like exercising regularly, practicing relaxation techniques like meditation, and cutting back on caffeine. And finally, I prescribed a low dose medications to ease his symptoms while he worked on his recovery. These steps gave Rahil his life back, and today he feels much more in control of his anxiety. Anxiety disorders are mental health conditions characterized by excessive fear, anxiety, or avoidance behaviors. There are different types of anxiety disorders, like generalized anxiety disorder of Mr. Rahil, panic disorder, we shall be talking about it in the next vlog, social anxiety disorder, then specific phobias, obsessive compulsive disorder, post-traumatic stress disorder, and anxiety disorder due to some medical condition. We just learned the symptoms that these are excessive worry or fear, restlessness or being on edge, feeling nervous, difficulty concentrating, sleep disturbances, rapid heartbeat or palpitations, sweating or trembling, and avoidance behavior. What are the causes and risk factors for anxiety? Research has shown that genetics, brain chemistry, life experiences like trauma, stress, medical conditions like thyroid disease, substance abuse, family history, and personality traits, for example, perfectionism, they have important role in the causation of anxiety. How we diagnose the anxiety disorder? Of course, comprehensive diagnostic evaluation by an expert, psychological assessment, medical history, physical examination, and some diagnostic criteria. How we doctors treat generalized anxiety disorder? Of course, first role is that of psychotherapy, which includes cognitive behavioral therapy, CBT, exposure therapy, acceptance and commitment therapy, and dialectional behavioral therapy. There's very important role for lifestyle changes like having regular exercise, attitude of mindfulness in life, relaxation techniques, for example, deep breathing, healthy sleep habits, balanced diet, and stress management. Different drugs have been tried, and these include benzodiazepines, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors are beta blockers. But medications will be prescribed to such patient by a doctor. So, if you or someone you love feels anxious all the time, like Rahil, know that help is available. Anxiety doesn't define you, and you don't have to face it alone. Reach out a doctor or mental health professional. Taking that first step might feel hard, but it can change your life. So thanks for watching. If you found this video helpful, please like, share, and subscribe. Together, let's break the stigma around mental health and help more people like Rahil get the support they deserve. See you in the next video. Thank you very much.